I wanted to talk to you today briefly about the anterior approach to hip replacement. This is not a new approach to the hip by any means. It's been used for many years to get into the hip joint and do various things around the pelvis, but it is new relatively in the last 5 or 10 years in the aspect of total hip replacement surgery. And it's largely caught on due to its success and word of mouth and how much quicker patients are recovering. Traditionally, hip replacement goes through the side of the hip joint from the back of the hip, and the only way to get to the hip joint itself is to cut muscles. In large part, that's still a great surgery. It's one of the most successful surgeries we have overall in all time. But through those approaches, you have to give time for the muscles to heal. Patients have to have certain precautions and restrictions for the first couple of months while those tissues heal. So there's certain things you can't do, crossing your legs, bending over to pick things up off the floor. What I like about the anterior approach is the incision is in the front of the hip. It's smaller. You don't have to sit on your incision, so it's a little more comfortable. But in particular, there's a direct interval between two muscles. You don't have to cut muscles to get to the hip, so you spread the muscles. You have direct access to the hip joint. You can easily get in the new hip prosthesis. This translates to a much faster recovery time, less pain in the first few days after surgery, and we can really get you back on your feet and back to doing things you want to do in general a lot quicker this way. Another thing that's great about the approach that I like is we use a special table for positioning you on the table or for the surgery, and it allows us to get access to the hip much easier. We also use x-ray during the surgery, so we know when we put the parts in right then that they are exactly where we want them. We can match your leg lengths perfectly and really make sure that we get you the most stable hip possible. We're not waiting until we see you in the office at the next visit. So I think that's another tremendous benefit for this surgery. In large part, this is my preferred approach to the hip. If when the day comes that I need my hip replaced, this is by far what I want done to me myself. It's been shown to have a much lower dislocation rate, quicker recovery time, and by far my preferred approach. I had a patient just a couple of days ago that did this surgery in the morning. When I was leaving the hospital after lunch, he was already walking with therapy the first time and literally set his walker down and came over and gave me a high five. So such a tremendous impact on me, and I appreciate your time.